So welcome everyone to the Marketplace session on adolescent health. My name is Daniela Meneses. I am a youth member of the Global Planning Committee, and today I will be facilitating the sessions in the Marketplace. As you know, the Marketplace is one of the most interactive events of the conference, as we will be listening to stories, ideas, projects from organizations around the world and how they implemented certain projects related to child and adolescent health. So I want to thank all the participants being here and also our extraordinary speakers who will be sharing their ideas and experiences over the next hour. We will have 3 different presentations today. We encourage you to all actively participate, ask questions, share ideas and comments with our presenters. For that, you can use the chat box and type your questions during the presentations. At the end of each presentation, some questions will be answered. And I want to remind you all that this session is being recorded and it will be uploaded in the platform as well. So without further ado, I am delighted to introduce you to our first presentation. It's called Let Youth Lead, Developing Responsive Health Systems for Youth in the Area of COVID-19 Pandemic, in charge of Dr. Michelle Farmer and Dr. Arti Varanasi from Advancing Synergy. Over to you.
Thank you. So I'll begin by sharing my screen. Oops. All right, so welcome everybody. Good morning, good afternoon, and good evening. We are delighted to be here with you today and share a little bit about our story focused on letting youth lead and developing responsive health systems for youth during the era of COVID-19. We will be focusing on 3 main objectives in our presentation today. One is to describe the approaches that have been taken by youth to provide input into responsive health systems and really talk about their engagement and advocacy efforts. And this is focused around NCD prevention among youth and people impacted by the COVID-19 pandemic. In addition, we're going to identify novel and innovative solutions that have been undertaken by youth for health education as it relates to COVID and mental health at both global and local levels. And lastly, we'll talk a little bit about our efforts in providing input into the youth call for action for responsive health systems. And we've taken an interesting approach to hopefully make it interactive and hear your feedback and experiences. We're going to focus on 3 case studies. And with that, I'm going to turn it over to my colleague, Dr. Michelle Farmer, to take it from here.
All right. Thank you so much, Arti. And welcome to all of you who are participating in this Marketplace session. As Arti brought up, we want this to be interactive. So we wanted to present some case studies that reflect some of the work that we have been doing together over the past year. And to give you some real life dilemmas that we have faced as we make every effort to be sure that youth are leading in every way possible as it relates to health advocacy around COVID-19 and non-communicable diseases. So we have 3 case studies focusing on youth-led solutions. One case study will focus on connecting and communication. Another one will be talking about the engagement of youth and some of the challenges that we've encountered. And then finally, we will have a case study on sustainability. I want to let you know that what we thought we would do is to give you all of the cases in once, and then we will have a question and answer period where we would really want to get feedback from you. We're happy at that time as we enter discussion sessions to provide a bit more depth or background into the cases, but we thought at first we would like to introduce the case studies to you. Okay, so next slide. All right, this first case study focuses on connecting and communication. Your organization has developed a plan for a 3-part webinar series on youth, non-communicable diseases, and COVID-19. The webinar series is focusing on youth who live in low and middle income countries. The youth enter the planning process for the webinar series at the time that the concept notes are being developed. So from the very beginning, and they are being included in all aspects of webinar presentation. The youth leaders suggest that Zoom as a platform would not be a useful communication platform for youth living in low and middle income countries because of the expense and connectivity. Your organization, though, would like this webinar series to be high profile and to maximize participation of as many non-governmental organizations and large multilateral agencies as possible. So that's case study and dilemma number one. Case number two, this is focusing on engagement of younger adolescent leaders. In this situation, your organization is invited to develop a slate of youth speakers for a global conference on non-communicable diseases in children and youth. It's scheduled to take place in London. The international organization focusing on heart disease, who is your partner, recommends one of their young speakers who is 17 years old. She's a well-known spokesperson for the organization, but when you reflect on this with other partners and with your organization itself, they're a bit concerned about having young people who are below the age of 18 to participate in the global conference. So that's case number two. And then the final case number three is about sustainability, respectfully sustaining and managing relationships with young leaders. Your organization would like to actively engage with youth-led organizations to prepare a side event that's going to be held in conjunction with the World Health Assembly. For those of you who aren't familiar, the World Health Assembly, or WHA, takes place in Geneva each year in May. Your organization wants to address health education and COVID-19 prevention in schools as part of this event. But in the process of setting up this side event, there are questions about what are the best ways to develop this relationship with these youth-led organizations. Is this going to be a one-off thing? Is it going to be a long-term and sustainable relationship? What's the best way to manage this? And what are some of the ethical considerations that you would have? So those are our three cases. Next slide. And these are some of the questions that we have. And we want to be systematic, if at all possible, as we go through these case studies. But if you have burning questions and you'd like to we want to get your questions in the chat box, and Arthi and I will want to go through them with you. If you would like also to speak, I think if that's possible, we can also accommodate that. So with case number one, we're asking about common platforms that you might use for webinars, and how effective do you think these platforms are within low and middle income countries? While I'm waiting for some people to feed back on that, one of the points that came up with the young people that we were working with for this webinar series was that WhatsApp was a much more convenient platform. It was not a platform that we had used before, but they indicated that they could easily enroll over 200 youth, and they gave us a very clear, well-described outline for the ways that WhatsApp could be mobilized into an integrated and novel interactive webinar series. Our organization, we kind of liked Zoom, and we thought, well, Zoom would work. But there was a lot of reservations about whether Zoom would be preferred, especially if we wanted to reach young leaders themselves. So I don't know if any of you have had any experience with that, but these were some of the dilemmas that we had. Arthi, I don't know if you'd like to add anything to some of the comments that I've made.
Yeah, as we were, and I think the theme throughout this conference when we're working with youth leaders has been really listening, right? And so listening what they need and what they have access to, and also understanding how their peers are connecting with each other, right? And designing a program and communication strategy that meets their needs and meets them where they're at with technology. And, we found the youth to be much more adept and, really up to date with all the technology platforms and different things, but it's really, especially when we're working across the globe, connectivity is a key point too, right? And bandwidth issues. So, would love to hear thoughts on kind of, what others have experienced potentially. And then, we can also move on to the next case study, but, really, because if you can't connect, then
Right.
communicate, then where do you go? Right. And
Right.
so it looks like we have one comment in the chat.
From Sydney.
Yes.
Yeah, thanks for that. They've switched to using Telegram because it has the same capabilities as WhatsApp, but with the ability to organize into groups and streams. That's a great suggestion, Sydney. Really appreciate that. What we opted to do was we opted to use kind of a hybrid format. We knew we wanted to get a large number of high profile NGOs involved, as well as getting youth leaders involved. So what we did was we extended the webinar series to 4 parts, and we offered one of the sessions as a WhatsApp group, and then offered one, well, actually there were 2 that were a combination of Zoom and Facebook Live, and then one that was a traditional Zoom. So the 3 series actually did show up as on the Zoom platform, but one was specifically using a WhatsApp format. What we found was that the registration was double on WhatsApp, and it was mostly young people that participated. So we felt that it was a great way to get the speakers to engage and connect with youth. And we recommend using these hybrid strategies as much as possible so that we can maximize our reach to young leaders. Let's go to the next case about engaging young people. I don't know how many of you have had this dilemma where you want to reach your audience with young people who are actually experiencing some of the crises that we're discussing. And in our case, focusing on non-communicable diseases, we had some young leaders and young spokespeople who were under the age of 18. This has been a common dilemma. We've had this experience in more than one case where organizations are reticent to bring in very young people. I'd love to get some ideas from you as to what steps you would take as you consider this speaker. Would you want to try to challenge the organizations that are reticent to bring in young people? Or would you offer some other suggestions for organizations that may have some reticence to bring in young people? Well, I'll tell you what we wound up doing in our case. We engaged young people, this young person, with our development of our global conference from the very early stages. So we didn't wait until everything had already been set up and then just slot a young person in. Just as we did with the webinar series, we brought this young person in at the conceptual phase of our planning, but we also invited her parents. And we wanted to be sure that the parents were well informed and that they were invited to participate fully with us so that they knew what was going on. And in fact, the young person did come to the global conference, and her parent also accompanied her. So I think there are some ways that you can actually actively engage younger people into conferences, but make sure that you are thoughtful about what type of accountability you need, all the special considerations you might have to take on. I think I see a number of comments in the chat box, Arti, if you...
Yeah, no, that was just saying that we had like 6 minutes left. So now it's less than 6 minutes. So
there's something in here from Senegal.
Oh, go ahead. That might have come just to you.
Okay.
Oh, here we go. Yes, I missed that. So we do have a number of comments. So Rachel shared that she could speak to this, that they work collaboratively with the organizers to understand why people under 18 were not permitted to participate and tried to establish strategies that respond to safeguarding and legal concerns that allow for youth participation, which is critical. And that's something that we've talked about. And then Kabiru mentions that they had a young person attend a conference in Senegal and also talks about child safeguarding is very important. And then Sydney mentions that the young people feel more comfortable if they're not alone when they're speaking, which I think is very important, right? And I really like that idea. So building that community, right? And the other thing that happens from that, and Michelle can attest to this in all of her work that she's done over the past several years, is these young people, these are networks that you're building and your friends, right?
Right.
So from all over, you then have this international group of individuals that come together for a common cause, which I think is really beautiful to see. And we've seen some of that manifest over the past 2 days during this core group conference. So
yeah, and the other thing that I think is very important, two alternatives to consider. One is if you have the time and the finances to do this, bringing young people in a day or two early as a pre-conference is very, very important strategy. And another option, if all else fails, is a video presentation from your young people. Videos can be very impactful and a good way to connect. We only have a couple of minutes left, but around sustainability, I think it's important to think about some effective ways to communicate with youth-led organizations effectively around how you want to engage and invest in them. It's really important, I think, to be very clear with young people and where it is possible to have a partnership that is promoted and sustained in the same way as you would with a large international NGO, that if there is funding, if there are funding considerations, making sure that the work is fully funded and that the funding is managed in an equitable way. The other issue around young people is we want to be sure that we are supporting their organizations and not in any way appear to be sucking away the talent that they have worked so hard to build. When you're working with these organizations, there's a certain level of respect and engagement that you want to bring to this that shows your willingness and your commitment to work with them over time as an institution in a fair and equitable way, but not in a way that would in any way, pull away from their talent, really helping to sustain and support their talent. Yes, and I think it would be great to continue this dialogue if possible. Arthi, if you want, we can go to the final slide that has our email addresses on there. We can, yeah.
Before sharing that, we just wanted to acknowledge a special acknowledgement and thank you to all the youth leaders for their passion, commitment, and courage to developing responsive health systems for today and our future. And a special thanks to those youth listed here. They were instrumental in the series that Michelle talked about. Damien Juma from Kenya, Laura Mwangi from Kenya, Christophe Jentayo from Rwanda, Anjali Singha from India, and then Ferdinand Sonyu from Cameroon. So a huge thank you to all of them, and they're doing amazing work in their own countries and beyond. And we just leave you with this final slide. We'd love to continue the dialogue and really see how we can continue to support youth and engage them in developing responsive health systems and letting them lead. So our email addresses are here, and thank you for your time, and excited to hear from the two other groups in our session. So Danny, back over to you.
Thank you
very much. Thank you so much for the presentation. Sharing those case studies was really insightful, and it gave us another feeling of how we can proper youth-led different strategies. So thanks for that. So up next, we will continue with a presentation of Plan International called Evidence on Peer-to-Peer and Adolescent Group Engagement on Sexual and Reproductive Health and Rights, Lessons from 5 Countries. And for this, I'll introduce Dr. Aliya Bibi and Dr. Ata Kabiru. So over to you.
Thank you very much, Daniela. Thank you, Michelle and Arti, for the wonderful presentation. I'm so happy to be here today, and welcome to all the audiences from whichever part of the world. Good morning, good evening. We are here. We're going to talk about Dr. Kabiru and I. Basically, we've been 3 presenters for this, but one of our presenter is a young adolescent from Bangladesh, and with the time difference, she could not participate in the session today. So it's just going to be Dr. Kabiru and myself, but we did bring in her views through a video conference. So we'll tune her in. I'll basically talk about our evidence on peer-to-peer adolescent groups and engaging on sexual reproductive health, and we'll talk about experiences in 5 countries. Sorry. So first off, I just wanted to do a bit of an icebreaker, and I thought it'll be nice if we could just, I mean, people in our field of work, we come across material and content. So I just wanted to seek audiences on an answer to this question that, what do you think? So I'm referring to a Gottmacher study that was published 2019. And in that study, it mentions that the number of adolescents in low and middle income countries who wanted to avoid pregnancy and unmet need for modern contraception. I have 4 options here, and I would appreciate if my audience could poll or put in the text box the responses. Was it 5 million adolescents who faced unmet need for modern conception, 10 million, 12 million, or more than 12 million? Dr. Atta, are you seeing the responses? Okay, I guess a number of people have added, and I'm sorry, I'm not able to see the responses in my window, but from the study, we saw that more than 14 million adolescents, they want to avoid pregnancy, but they are not able to access modern contraception. So this opens up a very big need for all of us within the development world to talk and focus about low and middle income countries specifically, where there's a huge population who are ready to accept these contraception methods, but they do not have adequate access. And this takes me to our flagship project that Plan International Canada launched. It's a mega project funded by Global Affairs Canada. It started in 2016 with an ultimate goal to contribute to the reduction of maternal and child mortality in 5 countries around the world. So Bangladesh, Ghana, Nigeria, Senegal, and Haiti. While we look at, as I mentioned before, one of our co-presenter, her name is Tamanna Saima. She is a peer group lead facilitator in Bangladesh. We wanted her to join in our presentation today, but she could not due to time difference. So I'm adding a video from her talking about her experience on how she led these groups and what does she see as challenges and lessons learned. Are people able to see the video?
No, we cannot see and
No.
not hearing.
We just see your slides.
Okay.
We cannot see your video, but if you want to share it maybe in the chat, that would be useful if you have a link.
Okay, I put it in there. Can it run from that end?
So Aaliyah, you probably have to stop sharing your screen with the slides and then share the screen where the video was playing. Because we can hear it, but we can't see it. And we didn't see the link in the chat either.
Okay, so I stopped sharing. Okay. Sorry. And how do I bring the video now?
Yeah, so do you have, when you click share screen, do you see where the video is? And then you click on that where the
Okay.
video is. Yep, it looks like it might be work. Yep, we see it now. So if you can turn the volume up, we can't hear it.
Okay, I understand that there was no video running, so I'd rather focus back on our slides then. I'm sorry for the tech issues here.
The link view was working, so maybe after the presentation, everyone can just click on the link and see the video later on after the presentation.
Absolutely. Thank you very much, Daniela. And now I would like to move further on. So the peer-to-peer group, Adolescent group work and approach has been applied to our show program in 5 countries, but in all these 5 countries, it was not uniform. So we adapted, we learned, and then we tailor-made this approach to most of the countries. From one out of these 5 countries, in Bangladesh, Ghana, Nigeria, some of the listed activities, and I would want to give you also a few minutes to look at a quote from one of our Adolescent peer group leader in Bangladesh on the interest that they have, the interest that has developed once they are part of the core group into their adolescent sexual reproductive health, and how they feel, how their self-esteem is higher, and how they feel empowered that they are able to tackle not their own issues, but also issues that their peers may come across. Just a little bit around on different activities that we've had in our peer group educators. Like any other activity, we've had lead to identify lead peer educators. We go through some information education IC material that is acceptable in that community and in that culture. We go through an intensive training course for our educators. We do have, whether it's a peer group approach, so there are two approaches that we talk about. It's a peer-to-peer facilitation group approach, and there's a champions of change approach that I will talk about in a while. In both the cases, we do identify facilitators that are peer leaders. Sometimes they are paid, sometimes they are not paid, depending on the community and the culture that we work with. And then again, whether it's champions of change or it's peer-to-peer, the beauty of these approaches are that they can be done by the organization themselves, but they can also be done by partners, by local stakeholders. And in some of our cases, they have been people from the ministries of health and education also who have been part and parcel of this effort. This is what I just talked about, the champions of change that we have done. What you would see in this slide is that the champions of change model has two distinct curricula. There's a curriculum for girls that really focuses on bringing up their assertiveness and starting to talk about the gender equality issues around them. And there's a curriculum that is for boys that talks about bringing up their positive masculinity and giving them, empowering them to talk about toxic issues that people bring up as, negative machoism or negative masculinities. And then there are also shared modules that how do they dialogue as a girl, as a boy, as a man, and as a woman in the community at the household level when it comes to talking about their health and sexual reproductive health and needs and rights. Something that I mentioned before, Champions of Change is not a very set curriculum. What we do is we do have the basics of these topics in these curricula, but then when we go into a country environment, we look at the existing content that is available to adolescents. We look at what is acceptable by the national ministries or the religious ministries, and we focus on adapting it. So we learn and we adapt. And I'm very proud to share that this Champions of Change has really started showing positive results. We are doing a meta-analysis of this currently, and we would have more results to show as we move forward. But this is a flagship program that has really been very popular within the adolescents and the communities themselves. With this, I would hand over the slide to my presenter, Dr. Atta Kabiru, to talk about Nigeria. He's our head of health in our Nigeria country office. Dr. Atta?
Yes, thank you very much, Alia. So I think just like Alia said, this was part of a program design we did for 4 years in 5 countries. One of the things we had to do was to actually understand the context before we started implementation. So what you from the survey data that we carried out before project implementation, we were trying to understand, what the adolescents were thinking, and you can see that when we tried to look at what adolescents felt about the risk of getting pregnant from one sexual intercourse incident, and we could see that less than, especially for the age group 15 to 17. Both for both boys and girls, they didn't really, they were not aware of this risk, and we could see that this could also contribute to the relatively low uptake of positive and protective behaviors during sexual intercourse as well. We also were trying to see that we saw there were different realities for boys and girls in these communities, especially concerning how they felt there was resistance to girls, unmarried adolescent girls accessing sexual reproductive health services. And you can see that for most of the boys, they really felt that there was significant resistance for these girls accessing services. And we were a bit concerned because we do know these boys will be the future, will be the men in the future. And if they were beginning to have this mindset conditioning going into the future, it means that they will also begin to maintain those patriarchal barriers that actually limit access to services. And so we try to say, how do we begin to engage the boys through a strategy, our male engagement strategy, to ensure that the boys are beginning to adopt positive masculinity behavior. One key information that also we saw was around we can see with COVID, there was a rise in sexual gender-based violence in the world. And so looking at this survey, you can see that for both boys and girls, they did feel that even when a married adolescent girls refused to have sex with her husband, that it was not right. And this we felt was a big issue, because if the men begin to think that the woman have no right to refuse to decide when and when to have sexual intercourse, that could lead to sexual-based violence. And of course, if the women also believe that they do not have that right, it could also begin to let them believe that they have, make them also begin to accept this behavior of sexual-based violence in the communities as well. Next slide, Alia. Next slide. Yeah, and for here, I think we are trying to see how do we see how adolescents are actually participating in decision making in the community level. And you can see from this slide, for all groups 15 to 19, both boys, female and male, the adolescent girls rarely or never contribute to community decision making, which of course means that they don't have voices both in the present and determining their futures as well. I'll hand over to Alia.
What did you say, Fatma?
Thank you, Dr. Atta. And now I'll talk very briefly on some of the findings that we've already started seeing from adolescent groups that have been assessed. We've seen that both girls and boys, they demonstrate a stronger ability to know about modern contraceptives, about dangerous signs of different issues that they might have, and even strategies on how to deal with that. So it's all, when they're part of this group engagement, they learn from experiences, they learn from the material, and they discuss their questions and their queries. The SRHR knowledge for girls tends to come from their mothers. This is something that we're very frequently seeing. And for boys, it's mostly from their friends. So what we've done in our projects, whether it's peer-to-peer or whether it's champions of change, we are trying not only to improve and enhance knowledge of the adolescents themselves, but it's also their parents, their guardians, their friends, because that's the support mechanism and that's where they seek more information from. And then while I'm talking about Senegal here, when we did the SRHR education sessions there, we did it in schools. So we adapted according to the school curriculum also. And we found that when we enhance and train the teachers to be the lead, to lead these groups, this is actually something that they find that they start trusting their teachers more with this kind of information, and they look at them as trusted sources to seek information, both in terms of boys and girls, even instead of their mothers and friends. So if they have a source at schools, if they're school going, then teacher training and capacity building really helps. But if it's out of school, then it's definitely other sources around them. Something also that as we moved forward, we started seeing that there are greater differences in the sexual reproductive health and rights knowledge between age categories. Sometimes in the development field, when we say adolescents, we try to put them in one compartment. In some countries, I see even the national policies terms adolescents as 15 to 19. So although we come up, with a curriculum that is focused on that, but once we start applying and start working with them, we see that the needs of different categories differ in some ways. For example, with our peer-to-peer and the champions of change, we found that for adolescents from 15 to 17, their knowledge level, their needs are a bit different than those, and even access to the resources is different than those of 18 and 19. And then again, across countries, we have seen.
I'm sorry to cut you. We have to move on because I have a really tight schedule. So could you please wrap up?
Okay, so this is just my last slide. As I mentioned, and Dr. Atta would have been the best source, as he talked about, that we respect our national standards, we look at our education system, and in Nigeria especially, the case was that it was not the education system, but also the Ministry of Health and religious leaders who wanted to make sure that this curriculum, this manual, this content is adaptable to the cultural and religious norms. And with this, I thank you all very much for listening, and we'll be open to any questions that you might have in the chat box. And Dr. Atta, can you look at the questions if there are?
Thank you so much to both of you for the presentation. I welcome you to answer the questions in the chat box because we have to move to the next presentation. So for the next presentation, I have to welcome to this amazing person, Rachel Shapiro and Christelle Bernaza. We'll finalize with this presentation of CARE. So it's called Girl-Driven Change, meeting the needs of adolescent girls during COVID-19 and beyond. So over to you, Rachel.
Hi, everyone. Thank you so much for being here. My name is Rachel Shapiro, and I'm a technical advisor with CARE based in Atlanta. I also want to take a moment to allow my co-presenter to introduce herself. So Maholi, do you want to take a minute to introduce yourself?
Thank you, Rachel. Hello, everyone. My name is Christelle Maoli Bernaza Sanchez. I'm 16 years old, and I'm a social activist for children's rights and one of the founders and general coordinators of ROTNA Ecuador. For me, it's a big pleasure to be in this webinar, sharing the actions that adolescents are carrying out in my country.
Thank you so much. And Monica, do you want to take a quick second to introduce yourself as well?
For sure, Rachel, thank you. Hello, everyone. It's a pleasure to be here with all of you. I am Monica Tovar. I am the Program Quality and Resource Mobilization Manager in CARE Ecuador. Thank you, Rachel.
Wonderful. Thank you both. And thank you so much for making the time to be here. So we have an ambitious schedule today, and I want to leave lots and lots of time for Maholi to share some of her experiences. But to provide kind of an overview, in October 2020, CARE's adolescent programming professionals across the globe worked together to document some of the unique impacts of COVID-19 on adolescent girls and to leverage the research that had been done by governments, by NGOs, by local organizations across the globe and across different humanitarian development and nexus settings. We ultimately published a report entitled Girl-Driven Change, Meeting the Needs of Adolescent Girls During COVID-19 and Beyond. And in kind of conducting this research and writing this report, we knew that a lot had already been shared that focused on the devastating impact of the pandemic on adolescent health and well-being. Yet very few resources had highlighted specifically ways that girls had mobilized and activated in order to meet the needs of their communities during this time. So we wanted to kind of bring forth a different narrative, one that better centers adolescent leadership and how girls are really leading change in their communities during this time in incredibly powerful ways. So I'd encourage you to look at the report. I will share that information in the chat, but globally, we looked at both the impact of COVID-19 on adolescent health, food security, WASH, education, but also identified some promising practices for girl-centered and girl-led COVID-19 adaptations. In this report, we identified 3 promising strategies across our programming in order to both meet the needs of adolescents during this time and promising strategies that were really centering their leadership during this time. The first was girl-informed assessment, planning, and accountability efforts in order to enable girls to shape assessment, planning, accountability when it came to programming. And for example, this looked like girl-led data collection around COVID-19 in Nepal, or consulting with adolescent leaders to understand how best to distribute hygiene materials and to adapt programming to meet their needs in Ethiopia. Youth-led digitized accountability tools like Community Scorecard in Malawi, innovation challenges that elevated and rapidly tested solutions to adolescents' ideas on adaptations and programming during COVID-19. We also worked on girl-centered risk communication, community engagement, and advocacy to make sure that girls had access in having accurate information around COVID-19, sexual reproductive health, protection, and vocational training. And so this looked like training local management committees, including adolescent leaders, to engage in COVID-19 risk communication with communities, peer education for hard to reach populations in areas like Sudan, building on past partnerships and capacity building that we had conducted with youth-led organizations to continue to strengthen their ability to advocate for adolescent health in Cote d'Ivoire, leveraging mass media such as WhatsApp groups, radio talk shows, hotlines, social media, and also low or no tech solutions, for example, plays, competitions, posters, in areas like Bangladesh, Nepal, Mali, Benin, and Afghanistan. Finally, innovative approaches to service delivery, community support, and system strengthening in order to make sure that health systems and other systems were adapted and able to support adolescent girls' rights, safety, health, and well-being. So for example, new clinic protocols that ensured adolescent continued access to sexual reproductive health services, clinician safety, and continuing to meet adolescent health needs through innovative solutions such as mobile clinics and the use of community health workers, peer-led GBV referrals by adolescent girls themselves to continue to ensure that GBV services were available and accessible during lockdowns in Niger and Bangladesh, and things like podcasts and virtual support groups in areas such as Serbia, Croatia, and Albania. So to briefly share our recommendations, because again, I want to spend most of the time sharing a kind of case study with you. We do provide recommendations as part of the report for how to better center and support girl-centered initiatives and leadership during the pandemic in 4 key areas. So girls' participation, leadership and voice, programming with and for girls, funding for girl-centered initiatives, and then girl-centered research and data analysis. And again, not going to go into depth on these because I want to make sure we have enough time, but just to really emphasize that most of these recommendations speak directly to resourcing and supporting adolescent leadership, working collectively with young people, adapting our programming in ways that proactively identify and respond to adolescent needs, and robustly continuing to monitor and collect data on how the pandemic is impacting young people. So for the remainder of the time, again, would encourage you to take a look at our report. I will share that in the chat. But for now, I'd really like to pivot to share with you a case study that really beautifully demonstrates how adolescent leaders have mobilized during the pandemic to shape the response in truly powerful ways. So again, I want to re-welcome my co-presenter, Maho Lee, who, as she explained, is a youth leader in Ecuador with a network called RADNA, which stands for the National Network for the Defense of Children's and Adolescent Rights. So Maholi, I would like to start with a series of questions to better understand your work and RADNA's work. So could you share more with the group? What is RADNA and why was it created?
Sure, Rachel. Well, RADNA, as an acronym in Spanish, means Red de Organizaciones por la Defensa de los Derechos de la Niñez y Adolescencia. As you told before, it's a national network led by children and mostly adolescents from different parts of Ecuador. Our main objective is to defend our rights through active participation, empowerment, and advocacy actions. This network was an initiative implemented by 3 teenagers who participated in a virtual forum last year related to problems adolescents and children are facing due to COVID-19. So RADNA was born in the pandemic period. Currently, there are 26 organizations from different provinces of our country participating in RADNA, including CARE Ecuador. And we have carried out big procedures for the childhood and adolescents benefits since our foundation in 2020.
Wonderful. Thank you so much. And I think you pointed out in your response that RADNA is working to support adolescent health and rights as part of some of the activities that you're conducting. Could you share a little bit more what specific areas of adolescent health and rights you are addressing in your organization and in your advocacy strategy?
Well, since last year, children and adolescents are facing different challenges because of COVID-19 crisis. And we are raising these problems to the national authorities. Regretfully, they have not taken the appropriate actions to solve those challenges. One of these problems is that our health has become vulnerable. The pandemic has had a great impact in our physical, psychological, and emotional development. In Ecuador, 4 out of 10 children suffer from chronic malnutrition, according to UNICEF. And according to a research from last year about COVID-19, many children and youngsters felt sadness, stress, and frustration during the pandemic, and they had no one to talk about these issues. Another enormous problem in our country is that in 210,000 households, girls, boys, and teenagers have left their studies in virtual modality due to the lack of technological resources. About 1 million children and adolescents don't have access to the internet. Moreover, just 37% of households in Ecuador have access to a computer. Now, education is a privilege that only few people can afford. Violence, including physical punishment, is a third issue that has increased in the pandemic. In Ecuador, 7 out of 10 children are survivors of physical abuse from their relatives, according to WHO. And these were just 3 of the most alarming issues in our country that engage us to become involved. We, as ROTNA, have the commitment to act in order to change the difficult reality that children and adolescents in our country are living. However, we can't do this alone. We need the support of all people who can contribute and are committed in defending our rights. We need, and we are working towards a country that is willing to create a dignified present for the current and future generations of children and teenagers.
Thank you so much. Those were some really powerful examples and statistics that I think speak to both the huge need for services, policies, and initiatives, but also the incredible work that Rodna and others are doing. So maybe as a final question before opening up to audience questions, how do you feel that the leadership of adolescent girls, because Rodna is led by young people, really impacted the health and well-being of adolescents in Ecuador?
Yes, we as young leaders have the role of being the voice of the children and teenagers who don't have the opportunity to participate in ROTNA. Children and teenagers who are living under difficult circumstances and can't raise their own voices. This is one of the main reasons why we created ROTNA. ROTNA wants to promote more spaces for participation led by children and adolescents. These spaces must be appropriate, efficient, and inclusive in our society in order to improve the conditions of current and future generations of children and teenagers, with the same objective of eradicating vulnerability and the omissions of our rights. I have to tell you that currently, our country is under presidential elections, and because of this, ROTNA is carrying out a digital campaign for persuading the presidential candidates to commit largely with the childhood and adolescents in this country. In order to do this, we are delivering an agenda which brings up the main necessities of the children based on their actual living conditions and talks about important themes such as education, health, child labor, teen pregnancy, and more. This agenda was elaborated after a query of about 20,000 children and adolescents in our country. And this campaign is the perfect example to show that despite the current condition of the world, we will do our best to make a real change in Ecuador because there are no limits in the fight for our rights.
Wonderful, so beautifully put. And I think I'd like to take this moment, we have just a couple minutes left to see whether we have audience questions, either on the powerful information you've just shared, Maholi, around ROTNA, or about CARE's report, or perhaps even just reactions, commitments that you have made within your organization to better center the amazing leadership and voice that young people are doing during this time. Any questions, comments? I'm also putting the report link in the chat. Monica, do you want to go ahead and translate Michelle's question? So does the program address youth in rural and urban areas?
Sí, Maoli, la pregunta es si es que este programa también está dirigido para los jóvenes que están tanto en el área rural como en el área urbana.
Sí, así es. Rodna forma parte en varias provincias del Ecuador. Inclusive nosotros, nuestro principal objetivo es llegar a esas zonas rurales donde muchas niñas y adolescentes no son escuchados y no son tomados en cuenta en la mayoría de los casos. Así que sí, nosotros tratamos de abarcar la mayor parte del país.
Yes, Rodna has presence in the rural and urban area, and the objective and the goal for Rodna is to achieve all the young people in the country from this area in order to give them a voice. Otra pregunta, Maoli, es ¿cuál ha sido el reto más grande o la barrera para poder llevar adelante el programa o la iniciativa?
Sin duda, la falta de recursos tecnológicos ha sido algo que nos ha hecho como la gran barrera, ¿no? Porque hay muchas niñas, niños y adolescentes que no tienen el acceso a un internet, y debido a la pandemia nosotros tenemos, este programa se lleva de manera virtual. Entonces, esa sería la mayor.
Gracias, Maoli. As Maoli said, Rodna born in the health crisis. So the biggest challenge that they are facing is the technological resources, because as you know, here in our country, in Ecuador, we have some restriction in the mobility. So their meetings are from platforms like Zoom. So the big challenge is the technological resources, because a lot of adolescents here in the country don't have access to this kind of materials. So this is the biggest challenge that they are facing now in their work.
Wonderful, thank you. And we're getting notice that we need to wrap up the session, but I want to take a moment again, Maholi, to recognize your participation. I know you're one of the youngest participants in this core group conference, and we feel so incredibly lucky to have your voice and perspective. So thank you so much for being here and for presenting with us.
Thanks to you, Rachel, for the space, and everyone who listened to us.
Thank you once again for the presentation. And I want to thank all the participants who joined today, and also our presenters. We had enriching presentations today with different youth-led solutions, with concrete examples of programs in diverse aspects of adolescent health, which I think is very important. So right now we run out of time, unfortunately. And as we conclude the session, I want to welcome you to join the conference website and join the award ceremony that is happening right now. And later on, we have the plenary session on climate change. So thank you very much, everyone, for your attendance.